Hello, and welcome to episode 11 of the Safe4F Stories podcast. I'm Jill Ramsay-Stewart, Network Leader with the Integrated Access and Flow Network and Safe4F Provincial Lead. Today, I'm chatting with Lindsay de Carvalho, Clinical Practice Leader with the Medical Unit of Digby General Hospital. Before we get started, I'd like to share a little bit about Lindsay with you. Lindsay was inspired to go into nursing when she worked with the Alberta Cancer Screening Program as an administrative assistant. There, she observed nurse practitioners' quality improvement work, which motivated her to pursue nursing. She graduated with a Bachelor of Science in Nursing from Vancouver Island University and began working in the emergency department. In July of 2020, in the early days of the COVID-19 pandemic, Lindsay began working with Nova Scotia Health in the emergency department at Digby General Hospital. When she started her role as clinical practice leader in October 2024, one of her first initiatives was to implement Safe4F. Lindsay, welcome, and thank you for joining me on Safe4F Stories podcast.
Thank you so much. I'm happy to be here.
Oh, wonderful. So you recently attended the Nova Scotia Health Quality Summit in Western Zone. What did you think of the summit?
I was actually super thankful to be able to attend the Western Zone Quality Summit. I found that it was filled with so much inspiring work being done by other units across the zone. Very interesting presentations, both the on-stage presentations and the hallway presentations. And I found it to be a good place to build partnerships with other people and figure out a way to collaborate across the province to spread the work that we've all been working hard to do.
Yeah. The quality summits are such a positive day to see some of the great work that's happening. And like you say, it's a great opportunity to collaborate, not only with your own zone, but across the province. So yeah, they're glad that you were able to enjoy it for sure. Yeah. So at the summit, you presented your unit's storyboard. In general, how has the Safe4F learning journey been for you?
Well, it's definitely a journey. It's not something that can be implemented overnight. Something that I think we struggled with the most was we started with our bullet rounds, and it was very difficult to get staff buy-in. Everybody was used to doing weekly rounds for each unit, and they took a very long time. So I found the weekly rounds to be quite tiresome. But I thought it was quite helpful being in a new role as clinical practice lead. I think it kind of looked like I was this new person coming in to change everything around, because not everybody knew me very well coming from the ER into the inpatient units, right? So I came in, we just implemented the bullet rounds, and it took some time, but once people started to see the positive outcomes that we were seeing with patients and getting treatments started sooner and interacting with the multidisciplinary team together, getting everybody together so we could talk about what needs to get done for each patient to get their estimated discharge date figured out, and their discharge criteria figured out, right? Things were getting actioned quicker rather than waiting a week or two, or someone would forget that they were supposed to do that. So now the next week we figure that out, right? So, and then we went from like these 2-3 hour meetings sometimes every week to we're down to a good 15 minutes per unit on each unit. Sometimes a little more for medical, a little less for RCU, but yeah, that's our average now. So I think we got some buy-in now.
Yeah. So it sounds like that was a journey, and you know, you kind of worked through it and stuck with it.
Mhm.
So, and like you say, when people start to see the value and how it's helpful for the patient,
Yes.
it helps it to become more sustainable. So
And
great.
everybody's looking forward to it now. It's part of the morning routine. So,
Right. Yeah. And
yeah.
when you see that culture shift, right? When you see that it just becomes a part of how you function, it just
Mhm.
helps with that sustainability piece so much more. So that's
Yes.
great. Yeah. So I have your storyboard here. Maybe I'll share it and you can tell us a bit more about it and then anything that you'd like to highlight.
So yes, this is the storyboard that we put together. We have Kim, our health services manager, listed there, myself, and then we had the team leads for RCU, medical floor, and the ER involved with implementing SaferF. And Rebecca Parks, our quality improvement coach. Our problem statement, as every quality improvement project has, we were just noticing that amongst many other inpatient units, that Digby General Hospital was experiencing prolonged length of stay, leading to especially admitted patients being stuck in the ER for long periods of time. And this does, as research shows, lead to patient harms because that's not what the ER has been designed to do. So they can become deconditioned, especially in a lot of hospitals and ours as well. Our PTOT social work, they tend to focus on patients on the medical floor because that's where they work. They don't work in the ER, so they don't know what's going on down in the ER, and so people can become deconditioned. So our aim statement, we were looking to have a reduction in length of stay by September 2025. So let's hope come September we have a 10% reduction. Either way, I think it's been great work because so some of the things that we implemented, though, even though if we don't have a decreased length of stay, we have some safety protocols put in place. So we actually, unlike other units, have included the ER, their admitted patients into our bullet rounds. So the multidisciplinary team actually runs on the admitted patients in our ER so that they're not missed when it comes to being seen by PT, OT, dietitians, all those people. Um, Along with the ER and our RCU unit and medical floor team, we implemented bullet rounds 9:45 in the morning. Everybody comes, including the physician, and we figure out estimated date of discharge and the clinical criteria for discharge. And then that way we can figure out who needs to see those patients.
Mm-hmm. Yeah, that's a really unique idea to include your admitted patients in ED that are waiting for a bed. So that's a really great way to prevent some of those hospital associated harm with being in the
Yeah.
ED for prolonged periods. Yeah, yeah, for sure. All right,
So,
okay, keep going.
sorry.
No, keep going.
So I was going to say, what we did notice though, is that there was discharge planning occurring much earlier in admission, starting right in our ER. So people were less likely to become deconditioned. It's hard to see the numbers just yet because, as you know, change doesn't happen that quickly, but staff have noticed that, patients aren't declining as quickly. Our meetings aren't taking as long. because sometimes it would take us a couple weeks to talk about one particular patient, and now it's a couple days. It improves patient and family satisfaction, especially in the ER, because people are coming down to see their loved ones. So we're tracking that on what's that app called? Oh, Tableau. We're tracking it on Tableau to see how we're doing there, and we're still making more changes with SaferF. We have to still include the bullet rounds on the weekends. We have already implemented the whiteboards that I'm sure you've heard of, which actually patients and their families love, because they can help out much easier because it's right up there on the board, and it keeps them informed as to what's going on as well.
Yeah, great. Lots of great work for sure. All right, anything else you want to highlight from your storyboard there?
No, I think that's good. Yeah.
Okay. All right, I'll just stop sharing there. So is there any advice you would have for other units who are still in the implementation phase and thinking about sustainability with SaferF?
Well, I think especially for the bullet rounds, because I personally think that that's where Digby really did some great work with SaferF. Is so build the bullet rounds into your routine. Think about the schedule of everybody who needs to come in. So around 10 o'clock is when most of our team members start their work on the unit. So that's why I start at 9:45, so they can start their day with the bullet rounds and figure out what their work day is going to look like, right? As long as it's before noon, because that's what we're supposed to do. Keep conversations at a minimal to keep the bullet rounds short and still efficient, because they're called bullet rounds because they're supposed to be fast.
Yeah.
Because you're more likely going to get buy-in if people aren't spending their entire morning talking about the same thing over and over again. I've heard some teams are setting up timers for the whole team to keep an eye out. But I got feedback from our team right from the beginning, and the majority, I think actually everybody, suggested that whoever's kind of running the bullet rounds just shut down conversations quickly and they'll listen. So
Yeah.
you just need someone who doesn't mind being the bad guy.
Yeah.
Yeah. And then for the first few weeks as well, ask for feedback from the people attending bullet rounds, because someone might have a great idea for change something. You don't want to force something that's not working, right? So you can tweak it, or completely throw it out and start over.
That's right. Yeah. Great idea to, gather that feedback, because like you say, you can, make some changes that, might tweak things, make it better, or you can, do that test and try something out, see how it goes. So that's great advice, because there is some units really that struggle with getting the bullet rounds kind of happening consistently in the attendance. So great advice. So what inspired you to present your storyboard at the Quality Summit, and would you recommend to other SaferF units that they consider doing the same in the Quality Summits next year?
What inspired me was, I think here in Digby, we did some really good work, and there were some things that we did different than other units, and I thought it would be great to share some of our learnings, especially to other rural hospitals, because we share a lot of the similar aspects, like our PTCs, 2 out of the 3 units or whatnot. So we all share resources, and that's why we kind of do all 3 units together. So I thought it'd be great for other units, especially rural units, to hear how we're doing it and exchange ideas. So get our ideas out there and how we're working here. Especially since we have a doctor who works here Monday to Friday, who's been so good to work with, and she comes to our bullet rounds every morning.
Oh,
and
wonderful.
I've heard that's been an issue at other hospitals. So maybe if it gets out there that we have a doctor who works with us, maybe some of the others will too.
Yeah, yeah. Create some competition. So
Yeah,
yeah,
yeah.
yeah. And do you think is something that's been helpful for you that other units might find helpful to, to present next year?
Yes, I mean, I think it's always great to get it out there what you're doing in your hospital, because you might be doing something that would work so well in another hospital, and they just need that one little tweak to get everything running smoothly in their own units. I think it's so great to have an exchange of ideas, and the summit is a great place to do it. Everybody's so positive, and you don't have to feel nervous. Nobody's gonna boo you at the summit.
Yeah, for sure. Yeah. All right. And is there anything else that you'd like to add or share for our viewers?
I don't think so. We did a pretty good job of running through the storyboard there. I would just like to say that I've had a great time working here in Digby on these different projects, and working with the team leads, and my manager and the quality improvement coach has been great. And I think that we do great work here, and it's worth sharing.
Wonderful. Thanks so much. So Lindsay, thanks for taking the time to share this with our viewers. You've got lots of great information, and like you say, just so much to share that other units might, take a piece away that can really help them with their implementation. So thank you for taking the time.
Yeah, absolutely. Thank you.
Yeah. So I was chatting with Lindsay de Carvalho, clinical practice leader with the medical unit of Digby General Hospital. This has been episode 11 of the Safe4F Stories podcast. Please like and subscribe to the Safe4F YouTube channel to catch upcoming episodes. Thanks so much for listening.